Hi, good afternoon, everyone. Welcome to the InnoCalifo 2025. This is Martin Law, your MC for today's webinar. Organized by the Innovation and Technology Commission, InnoCalifo is one of the highlights of Hong Kong's annual innovation and technology events. This year's theme is special. It is INT Unlocks Your Dream. Supported by more than 50 partner organizations, InnoCalifo brings you a diverse range of interactive activities as well as inspiring webinars. Today, we are very pleased to welcome Dr. Russell Chen to share with us. Dr. Chen is the co-founder and CEO of eSense Innovation and Technology Limited. Dr. Chen today will be presenting on the topic of innovative biomedical imaging platform for vital organ, community, and home screening. Now, before we begin, I'd like to remind everybody that today's section is simultaneously live streamed on both Zoom and YouTube. If you have any questions during the seminar, feel free to send them to us via text. If you are watching on Zoom, please use the Q&A function below. If you're watching on the YouTube, please use the live chat features. If time permits, we will relate your questions to the speaker during the last 5 minutes of the section. Now, without further ado, let me pass the stage to our speaker. Dr. Russell Chen, the floor is yours.
Thank you for the introduction. Okay, first of all, thank you for the invitation. It's an honor to be speaking here. A little bit about my background. I did my PhD at Hong Kong U and then postdoc at Stanford and NYU. 3.5 years ago, I came back to Hong Kong, and 2 years ago, I started eSense. And our motto is doing well by doing good. And our mission is to make broad early disease detection practical in communities. And it has everything to do with primary healthcare, which is the most essential component in a well-functioning healthcare system. And it also serves as a gateway to specialized secondary and tertiary healthcare in hospitals and institution settings. Recently, the government has launched a primary healthcare blueprint, shifting from treatment-oriented healthcare to prevention-oriented healthcare, calling for preventive screening and chronic disease monitoring outside of hospitals and institutions, aka telemedicine, healthcare from a distance. However, in-depth diagnostic screening and chronic disease monitoring remains challenging, partly due to the lack of accessible imaging devices, where biomedical imaging plays a huge role in diagnostics and monitoring. MRI, PET-CT, they're great. However, they're bulky and costly. PET-CT itself has ionizing radiation. Recently, we have portable ultrasounds, which are more affordable. However, it has limited field of view. And all these imaging modalities requires operators to operate them, such as sonographers, radiologists, radiographers, doctors, nurses, etc., etc. To address these unmet needs, we need even more portable and accessible imaging modalities. It has to be non-invasive, affordable, and operation friendly. Like even high school students should know how to use them. But before we talk about like the technology itself, like maybe I can share a story about my uncle, where it was a normal working day where he felt a little bit off, what we call a sub-health state. After work, he went to the clinics, like primary healthcare clinics, and the doctors measure his blood pressure, vital signs like sugar levels, and nothing was that off. So he was sent back home. Unfortunately, after 6 months, he felt kidney pain and was diagnosed with chronic kidney disease, where I saw his quality of life dramatically changed. That got us thinking why primary healthcare focused so much on metabolic risk factors. What about our vital organ health? And in fact, primary healthcare provides valuable touch points for early organ disease detection so that we can do prompt treatments to prevent disease progression and prevent costly health outcomes. Moving on to some statistics, um, in China alone, there's hundreds of millions of people suffering from chronic lung diseases, fatty liver diseases, and also chronic kidney disease, not to mention the world. Around 10% to 30% of them are suffering these chronic organ diseases. As such, at eSense, we developed a device called VitalCheck to target all five vital organs: brain, heart, lung, liver, and kidney. So we wear a belt around the organ of interest. After data acquisition, the raw data will be shoot to the console for data processing. After image reconstruction, processing pipelines, we predict some of the clinical standard readouts. For kidney itself, it's eGFR. And for heart, it's ejection fraction, etc., etc. We also understand the importance of data security. That's why we have an option of doing it offline within the console or online at cloud with the cloud. And I'm happy to share some of our first phase of clinical validation where our lung, liver, and kidney received around 80, 90, and 95% accuracy. And we just kickstarted our heart clinical validation. All of these are in collaboration with Queen Mary Hospital at the University of Hong Kong. So all these clinical validation, we use a gold standard device to benchmark. For example, in the lung case, it's spirometry. For our liver, it's FibroScan. And for kidney, it's blood and urine test. So these are clinical standard readouts where you can take these tests in hospitals. However, it's not as portable and not as accessible as our device. And for heart, we use echocardiogram. It's basically a human-sized device. So how does EIT work and what is EIT? EIT estimates the distribution of electrical properties over a cross-section through electrodes on the body. So imagine you wrap around the belt with 16 electrodes. Two electrodes establish that electric field. And then the adjacent electrodes would measure its potential difference or voltage measurements. You sweep it through different electrode pairs, and that's not it. We can also do tomography, which is shifting the establishment of the electric field from, for example, electrodes 1 and 2 to electrodes 2 and 3. And with all the tomographic data, we can do image reconstruction, and this is an example of the lung image reconstructed. So for context, like how do we do image reconstruction? So imagine we scan it from the bottom, we see two bumps as the projection data. And if we scan it 45 degrees, we still see two bumps. And we scan it horizontally, we see a larger bump horizontally, only one. So with these projection data or tomographic data sets, we can start to smear it in space, and it will slowly form an image. So when we have more electrodes, more angles, we would have like a better image itself. At eSense, we not only do basic image reconstruction, we used proprietary uh, model-based method to do the image reconstruction. It's something like an inverse problem and an optimization problem that we can reconstruct the image. So most of the EIT commercially available are lung imaging devices. So why can't we do vital organs? The reason, like two of the reasons are it has low signal to noise ratio. We also have low contrast to noise ratio. And in order to improve that, we can improve its hardware. We can also improve it through the software. And also like the establishment of this electric field, we can vary its frequency ranges. So for hardware, we improved instead of 16 electrodes, we have 17, where that we call a reference electrode basically stabilizes the result, the acquisition and signals. And our internal experiments show that there's a double of SNR with that hardware change. Besides, we can also leverage recently developed AI methods or machine learning methods to detect low SNR electrodes. And we not only can detect them, we can also improve them with AI. And after improving these signal qualities, like from a raw data standpoint, we would feed forward to do a more typical or classic image reconstruction, image processing, pre-processing, segmentation, um, unmixing of the spectrum, etc., etc., to gather like different features. Once we have all these features, we can also train a machine learning model to predict clinical standard readouts. For the kidney case, it's eGFR. So besides the clinical trials that we've done over like 300 patients, we also scanned individuals in the community. We have scanned over 600 individuals over the course of 2 years. We partnered with we scan people in DHCs, district health centers. We also partner with YWCA. In the case of YWCA, we would train their volunteers because YWCA has multiple units. One of the units are serving younger high school students, and another unit would be serving elderly or elderly. They have their own elderly center. So we train the high school students, volunteers, to use our device and operate them on elderly to do health screening. And we also did health checkups in Tuen Mun district. We scanned over 105 individuals over the course of within 3 hours. So during that process, we first asked the individual for consent because this is a relatively new technology and new device. And we also ask them basic information through a questionnaire. For example, some personal information, some social history, whether they are eating well, like they are on a diet, they intake enough water, how much exercise they do, etc., etc. So how easy it is to use our device. So over here is an example of the
eSense.
overview of how you can use the device from an operation standpoint. So it involves a sensing belt, where on the sensing belt there are electrodes, and when we scan for kidney and liver, we can identify the lowest risk and then place the belt onto the person. And because of the electrodes, they have some adhesion, so it would stick to the body. And then afterwards, they connect to the console. And last, we attach this reference electrode to boost our signals so that we can have more accurate results. And on the console, there's a user interface, which guides you through the process. And for liver imaging, we require the individual to breath hold for 7 seconds. Because when we breathe, the diaphragm will push the liver, and when the liver is moving, it's not the best for imaging. So that's an overview on how we can do the imaging itself with our device. And afterwards, with the results, we would we would print out the label and stick it onto a report and give it back to the individuals. And then in the report, you would see different ranges of scores and also their risk levels. So if the person has like mild risk, maybe he or she could alter their living habits. For example, if they have mild risk of fatty liver disease, we would suggest them to maybe you want to cut down a little bit on like good food, fatty food, etc. And maybe do more exercise. However, if the person has been scanned and judged as a high risk individual, potentially we would ask them to consult a family doctor or go to primary health checkups. And in these community events, we also would share um, like pamphlets of what the kidney or liver does. If you don't treat fatty liver disease, what would happen? Like, for example, it can evolve into fibrosis, which is very hard to reverse. And if you don't treat fibrosis, it can progress to liver cirrhosis, which is irreversible. So we don't want that to happen. And that's one of the reasons why we're promoting health awareness. When you have fatty liver disease, you probably want to treat it right now. And this is also another example of a recently done event where we found there's over 75% of individuals in the community of the underserved population having a mild, moderate, or high risk of fatty liver disease or chronic kidney disease. And some of the statistics strike us with like maybe around half of the people have abnormal BMI. Around half of the people are inactive, meaning they don't exercise. And only 10% are active and highly active, meaning they have enough exercise. And one of the things that strike me more is in terms of water intake, there's 95% of the scanned individuals have critically low or below standard water intake habits. And also, around half of the individuals have blood pressure issues, like either it's elevated or even like stage 2 hypertension. And this cannot be done without the team, especially our collaborators, the doctor, clinical professor, and in Queen Mary Hospital in Hong Kong U, like kidney, liver, heart, and lung doctors. Also collaborators overseas in New York, Stanford, Harvard, and Hawaii. So again, like the overview of how this whole system works is it involves a console, a sensing belt, and then also cloud computing, which is optional. You wrap around the organ of interest, and then the console would send signals to establish that electric field through the sensing belt across your body. And then all the other electrodes would measure its potential difference. And these raw data would be sent to the console again. And after acquiring these raw data, you can shoot the raw data to the cloud for image pre-processing, image reconstruction, image post-processing. And afterwards, results can be displayed on the screen as clinical standard readouts. For lung, it's spirometric readings, FEV1, FVC, and then also the ratio. For liver, it's the FibroScan clinical standard readout, CAP, control attenuation parameter. For kidney, it's eGFR, and for heart, it's ejection fraction, EF. And because data is a very sensitive issue, and some hospitals don't want data to be uploaded onto the cloud, so we also offer offline processing, meaning all processing happens within the console without sending it to the cloud offline. And in the future, we plan to have a home unit where we can give it to the patient or individual to do home monitoring so that the doctors can communicate through a platform with the patients using these home units to promote a healthy lifestyle for everyone and shifting treatment-oriented healthcare to prevention-oriented healthcare. Here's a video of overview on our system.
Our population is aging globally, and this is the main cause for an increasing prevalence for chronic medical diseases. There are more than 2 million people with chronic diseases in Hong Kong alone. As such, the Department of Health has launched a primary healthcare blueprint. Within the Hong Kong population, there are more than 30% of patients with fatty liver disease, more than 10% with chronic kidney disease, and more than 10% with chronic lung disease such as COAD. Screening and prevention is a cornerstone to improve patient outcomes and reduce healthcare burdens for chronic diseases. This can be achieved via preventive screening and also chronic disease monitoring outside hospital settings via some telemeans. And our project is set forth to address these challenges and unmet needs.
As doctors, we use different medical devices for diagnosis and treatment monitoring. However, the concept of medical devices is now changing. we now try to implement components of telemedicine and accessibility. And in fact, during the COVID pandemic, we have seen a rapid growth in telehealth medications, and we do believe that this trend will stay with us. However, in-depth diagnostic screening and chronic disease monitoring remains a challenge, especially in clinics, in community centers, and at homes, due to the lack of accessible imaging devices.
With a biomedical imaging background, I always imagine what would happen if we can make imaging accessible to everyone at home, community centers, and clinics. We are fortunate enough to put together an EIT accessible platform for brain, heart, lung, liver, and kidney function assessment. A little bit about the technology, EIT, or electrical impedance tomography. It estimates the distribution of electrical properties over a cross-section through electrodes on the body. It involves a set of microcurrent injections, voltage measurements, tomographic data collection, and complex image reconstruction and processing within pipelines.
We understand the importance of speed to market, and fortunate enough that all medical-grade EIT devices are Class 2 in NMPA, CNDR, and FDA. This allows us to obtain product registration and certification in 1 year after the fundamental research is done. This means our first medical-grade product can be ready for mass production and sales in 2027.
We are also developing a sustainable business model with 2 revenue streams: the sales of device and the scanning and consumable income. We believe in doing well by doing good, and we expect to start generating revenue in 2027.
Outcome of this project not only facilitates the accurate and reproducible non-invasive measurement of liver fat, it is also easy to use. And this would imply the measurements can be performed not only by healthcare professionals, but potentially also by healthcare providers in community centers or in elderly homes, or even by patients themselves. The market of this device is potentially huge.
Our device makes use of electrical impedance tomography to assess kidney function and fibrosis. The method is non-invasive and correlates well with standard laboratory tests, and hence hold great promise for screening, early detection, and monitoring of kidney impairment.
With that, I welcome everyone to the opportunity of doing well by doing good, and I'm open for questions. Thank you very much.
Thank you. Thank you, Dr. Chen, for your brilliant presentation and presenting to us avant-garde medical device. You know what? I actually come from the same medical industry background. At the very beginning, you mentioned about that, the entire medical regime or entire world is actually changing from the conventional treatment world to nowadays the preventive and precision. I know how important it is because I guess, let's see if you agree, I guess the pain point like in Hong Kong is that we have the aging population. We have a lot of urban disease. So year by year, I guess the demand for medical services actually become more and more than the supply. And from time to time, as far as I know, if the patients want to have some really a good screening, like the traditional CT, MRI, if they have to line up in the public hospital, it has to wait for a number of months or even years. So what I get from you is your EIT device actually provide a very good opportunity for people, before they really go for the traditional screening, they can use a very convenient EIT to have the first tier of, let's say, stratification, so that, if this is a serious case, they can go immediately to the traditional scanning for the more detailed screening. Am I correct? So, this is not a replacement of the MRI or CT, but it provides a stratification so that it could help more and more people to have faster or to have stratified their seriousness.
Yeah, I do agree. We're not competing with MRI or CT, of course. We're trying to do an earlier step. We complement CT and MRI. We also empower individuals to make that decision because oftentimes, if you think you have a serious case or like you want to do a checkup real quick, you can opt to private clinics or clinics to do it. You can also like if you don't think it's a serious or urgent case, some people would opt for public hospitals. But then oftentimes people don't know how to make this decision. And with this simple and also like high throughput screening device, we empower the person to make this decision, decide what's best to move forward with themselves.
Absolutely agree. I guess, even for the below the line people, I mean, they have no choice but have to wait at the public hospital. So I guess if there's such a device which is convenient for people to check themselves, I guess it will be really helpful for the entire society. Now, Dr. Chen, can I ask you the other question? I heard that you mentioned about because of the data privacy concern, you can choose between the online or offline. So it actually brings out a question of if there's any other ethical concerns about using this kind of medical device that is accessible by the general public. I mean, other than data privacy, would there be like, or there's any unprofessional interpretation of the results, etc.? Would that be some of the concern that when you develop such a device for the general public?
Absolutely. So in terms of operation, right now we say we aim to train people to operate the device. That's it's required. It still requires training. It's just that it doesn't require a medical professional to use the device. And after some training, a lot of times we also have safeguards on the device itself to ensure like the data quality is up to standard before moving forward to processing and also outputting a result.
I see. I see. So those are the measures. Okay.
Yes.
I see. The other question is, now I see the EIT works with a purpose. Is there any future developments or enhancement you are seeing for the EIT for the, general wellness of the entire community?
Yes. So I think like from a future perspective, we want to also develop the heart and brain applications. One of the reasons for that is we can use the heart as an example. Oftentimes when we look at charter marathon, like unfortunately, there's always one or two cases that suffer from heart attack. And this is from a literature standpoint, it's not entirely surprising because oftentimes the ejection fraction normal people would have 50 to 70%. That's a normal ejection fraction. However, some people would have like 20% ejection fraction, and they don't know because you don't feel pain, you don't feel anything different. But then when it hits you, it's a heart attack. It's a heart failure situation. And we think with the heart application, we can screen out among the population who has undetected heart failure, and they can like get the right treatment. Maybe do a echocardiogram, which is the gold standard right now, and then they can like live a healthier life, and without the hiccup or the shock of a heart attack.
Yeah, I guess this is a very good practical scene that you just mentioned about the Standard Chartered Marathon. Like the national game is going to happen in Hong Kong and more sports events is going to happen in Hong Kong. I guess, yes, you're right. I heard some of the cardiologists mention about that. Some of the heart disease, as you mentioned, I mean, there's no syndrome at the very beginning. So it would be very good to have such a preventive medical device to help people with that. Thank you so much. Thank you so much. So now the seminar is about to end. So once again, thank you, Dr. Russell Chen, co-founder and CEO of eSense Innovation and Technology Limited. Thank you so much for your valuable insight and your sharing of the presentation.